My name is Felista Obara. I'm going to take you through this session of finger pricking and good blood collection. It is important that we get accurate results for the test that is done. To attain this, good sample must be taken, as well as the use of good quality test kits. In order to achieve this, we'll need a valid test kit and quality blood sample. How do we obtain the quality blood sample? The quality blood sample we are going to get from a finger prick from the mother who has already been done a pre-test counseling and is willing to be taken through the testing procedure. Once the client has been taken through the pre-test counseling and has given the consent, request the client to give you any of the fingers from the 10 fingers. Assess the finger for skin texture, any wounds or cuts, any swelling which might be there, any scars, and any deformities. Should any of these appear on that finger, then that finger is to be omitted and zero onto any other finger. Let's look at the items that we need to carry out this procedure. Your hands must be gloved. Then you are going to need a sterile lancet for pricking that finger. You are going to need a spirited swab for swabbing the area so that it is clean. Then you are going to need a dry cotton swab, which you are going to press on the patient's finger to stop the bleeding once the pricking has been done and your blood sample has been collected. Using a spirited cotton swab, swab the area of the finger with a circle from inward to outward, and then prick the middle of the finger, because if you prick towards the tip of the finger, it is more painful. Why is this? Because the nerve endings end towards the end and the patient will feel more pain. Then you will need a dry cotton swab to stop the bleeding once the pricking has been done and you've taken your blood sample. The following steps then should be taken when we want to get a finger prick in the aim of obtaining a quality sample. Clean the site that has to be punctured with an alcohol or spirited swabs. Let the area air dry. Using a sterile blood lancet, puncture the cleaned site. Wipe away the first drop of blood with a clean, dry cotton swab. Use gentle pressure to produce a flow of blood. Fill the capillary tube or micro collection device as needed. Apply a dry cotton swab to the punctured area and hold it in place until the bleeding stops. Discard the generated wastes into appropriate receptors. Post-exposure prophylaxis, in short PEP. What does it entail? PEP is a set of procedures or steps that all healthcare givers should be well adversant with. As healthcare providers, one may get injured during your work. There should be then set down procedures that one then should follow to get aid in the event that you don't get infected with HIV/AIDS, hepatitis B, and even hepatitis C. So in the event that you are pricked, the first thing that the person or the healthcare worker should do is that you put the finger that has been pricked under running tap water for 2 minutes. And please do not squeeze. Why don't we squeeze? When you squeeze that site, then the macrophages will run to the site of the injury, and we all know that the macrophages contain the CD4 markers, which the HIV virus has an affinity for. So you will be giving the HIV virus the opportunity to lock onto the CD4 and be carried into your system with the macrophages. After that, then you will go to set out places or sites within your institution for the PEP pack. The injured healthcare giver, once in the designated area within that institution where the PEP has to be given, will then undergo a pre-test counseling. In the pre-test counseling, the healthcare giver will also be told of the adverse effects of this drug and how the drug is supposed to be taken. This healthcare giver then will come back for another pre-test counseling after 3 months and 6 months respectively. During this time that the healthcare giver is on the medication, the healthcare giver should observe the following. Number 1, abstain from sex if they can, or play safe sex. If she is a breastfeeding mother, she is advised to abstain from breastfeeding. Do not donate blood and do not donate any body organs. Universal precautions. This entails to service providers' safety, the environment, and the patient. All healthcare givers must adhere to the given guidelines, which include hand washing. Hand washing is the most single effective method of preventing spreads of infections between healthcare workers and patients in the hospital. Leathered hands should be vigorously rubbed for 15 to 30 seconds and rinsed in running water, then dried using a clean towel, disposable paper towel, or air dried. There are 3 categories of hand washing. One is the social hand washing. This procedure renders hands socially clean. Washing hands with plain water removes about 50% of transient microorganisms, while the addition of soap removes 80 to 90% of microorganisms from the moderately soiled hands. Social hand washing should be done before handling food or eating or feeding a patient, after using the toilet, before and after nursing a patient, whenever hands are soiled, before and after gloving. Hygienic hand washing. This is a procedure where an antiseptic detergent preparation is used for hand washing. It is a more effective method of removing and killing transient microorganisms and should be done before and after performing invasive procedures, before and after caring for susceptible patients, before and after handling wounds, drains, catheters, etc., before and after gloving when carrying out invasive procedures, after contact with blood and body secretions, especially in situations where microbial contamination is likely. Please take note. A defined technique for hand washing is probably of greater importance than the antimicrobial agent used. The third aspect of hand washing is the surgical hand washing. This is a procedure where highly effective antiseptic capable of destroying transient flora and eliminating resident microbes are used. This is indicated for all surgical procedures. Hands should be washed in an antiseptic detergent preparation for 3 to 5 minutes, then rinsed well under running water and air dried using sterile disposable towels. The other gadgets that we use in universal precaution is the protective devices. These fall under gloves, gowns and aprons, masks and eye shields, protective headgear and shoe covers. Please note, gloves should not be regarded as a substitute for hand washing. Antiseptic used for pre-surgical disinfection of patient's skin should be those with a broad spectrum of activity and a residual effect on skin.